Hello friends, I am Dr. Abhishek and here I am back with another video to share my tips and strategies to utilize your MBBS and UG days and your internship in the best possible way. So let's get started. Friends, the key to any competitive exam is to start early. You need to start preparing in the mood of the exam as early as possible. You need to get accustomed to the new pattern as early as possible. Start integration and clinical orientation as early as possible. You need to attend your wards right from your second year. Do not bunk them. The major part of the learning happens in the wards and the clinics. It's all about your soft skills, including communication, curiosity, and critical thinking, which are as important as technical skills. Because, friends, the world around you keeps on insisting to accustom to the new technology. But no, human touch is the key in learning medical education. So, you must attend your ward sincerely and regularly. Application of what you study in the wards, of what you study in the books is very, very important and it holds the key in any competitive exam. What not to do in this UG time? Say a big no to the guidebooks or the reference books or the MCQ books because the pattern of the exam is changing every year and there is no point in repeating the questions which have been asked 4 or 5 years back. Say no to previous NEET or AIMS questions because, as we know, friends, next is approaching and we are not sure whether AIMS PG will be there or will be replaced by next. So, you should not focus on the previous questions anymore. The key is only in three things. First thing is classroom learning. You must attend your wards and your classes regularly. You must listen to them mindfully. Second, reading standard textbooks. Standard textbooks are Robbins, Harrison, and Bailey and Love. I have discussed about them in the next slides. And attending your clinical postings mindfully. Now, attending the postings is itself not enough. You must read the topics or the cases which you come across in your ward, and you must go through the cases and the first line investigations and the first line treatment. I'll discuss about it more in my next slide. Suppose pattern of the next. We all know that the next year there will be NEET, but after that, next is on the run. So we should know what is the pattern and what is the scenario regarding next. Next one. Next one is a pass or fail exam. Plus, the marks in next one are important for the to get the PG seat of your choice. So, prepare, take this next one exam seriously. And my dear friends, mind you, you are giving next one after your final year. That is, before attending your internship, before going through the investigations and the treatment protocol. So, you must be accustomed to them in your UG days, and you cannot wait till internship to know about them. Next two will be a practical exam. It's going to be pass or fail exam. You just need to clear the exam to get your MBBS degree. So to get the branch of your choice to in your dream branch in your dream college, you need to score high in the next one exam. Let's see the supposed pattern. I'm not sure this pattern will hold on or not, but supposedly this is the pattern of next one. Remember, friends, it is a high stakes exam. Take this exam seriously. You cannot score 50% in an MCQ exam if you take the exam lightly, if you are not thorough with your concepts. So, attend the exam seriously. Next one is the exam which you'll take after your final year. So, you need to take this exam seriously. It's going to be a 3 day long exam with medicine and allied branches and pediatrics, with medicine carrying 120 marks. Allied branches are psychiatry and dermatology, and pediatrics carrying 60 questions. Surgery and allied branches are carrying 120 marks and ENT is carrying 60 marks. Surgery and allied include anesthesia, radiology, and orthopedics. Obs-Gynae and allied. Obs-Gynae and allied branches, it includes radiology, the ultrasound characteristics and all, and ophthalmology. These three will carry 60 marks. So it's going to be a 3 day long exam with 540 questions. Recently, this NEET 2020 was a 300 question long, grueling OPD session. So, next one is supposed to be like an OPD session, like the case and the clinical history and the question. So, you must be accustomed to this pattern right from your UG days. 10% of the questions will be applied from applied basic sciences, that is your first year and second year subjects, and about 10% of the paper will be from PSM. PSM is in everywhere, friends, so never take this subject lightly. That is preventive and social medicine, or social and preventive medicine, SPM. It's very, very important. I'll discuss about this subject in the next slides. So the first and the most important thing is to attend your wards mindfully. Attend your wards sincerely. You will not be exposed to clinics before you give the actual next exam. This is very important, friends, because many of us used to give NEET after internship or after 1 year gap of internship. But you will not get this gap. You will not get this internship time to learn about the things or the procedures being done in your wards. You should be accustomed to them in your UG days. Do not bunk your wards. Attend them regularly and mindfully. Make a comprehensive logbook. This logbook is the one that is going to make or break your rank. I'll discuss about it in the next slide. Keep the logbook updated. Keep a logbook for every ward you attend for medicine, surgery, obs gynae, and pediatrics. Knowledge is being disseminated everywhere, friends. You just need to go there and get it. Talk to your seniors, talk to your PGs. Think of the students who are willing to teach you. Go to the seniors, go to the postgraduates, or go to the senior residents who are willing to teach. You can go to them anytime in your ward. So, do not just waste your ward time or do not just go to wards for the sake of attendance. Attend your wards mindfully. Go to the seniors who are willing to teach you. Present cases along with them. Then only you'll be accustomed to the cases and the treatment protocol. So let's discuss the idea of a comprehensive logbook. What is it? This book is going to be the key for your success in the next exam. So friends, this book is going to break or make your rank. So from second year onwards, you must have a logbook for the wards you attend. Make a list of the cases you see in the ward. The case, brief diagnosis, brief history of the case, and then the pathophysiology of the disease when you go back home or go back to your room. This is very important, friends. You see the case, read the diagnosis, then brief history, but you must read about the pathophysiology of the disease when you go back. It can be from your Robbins, or it can be from your pharmacology, or it can be from your microbiology. You should integrate them with the disease you came across in the wards. The first line investigation you do in case the patient comes up with the disease or the symptoms, the first line management and the treatment of choice. So, any case you come across, you should make a list with these five subheadings. You must make an effort after going to your room to study about the disease. For example, make your clinical snippets. These snippets should be short and crisp. Clinical snippets are going to help you in a long way. Take necessary images of the topic whenever needed. We all have smartphones, my dear friends. We can utilize them in the best possible way. Divide these images into folders in your phones, dividing them into medicine, surgery, obsgyny, pediatrics, ophthalmology, ENT, anesthesia, psychiatry. All you can get a wide range of images. You can have a folder of your own, and these will be the key for your success. These images are going to help you in a long way in the future. So take images of any necessary photographs, any procedures, or any clinical case or anything, and divide these images into folders and save them in your phone. For example, if you come across a case of breast abscess in your surgery ward, you take the history of the breast abscess, swelling associated with pain and discharge, since how many days, its relation to pregnancy, its relation to lactation, all that. What is the first line investigation you do in a breast abscess? It is ultrasound. The investigation of choice is FNAC. Again, investigation of choice in a pregnant female is ultrasound. You do not do FNAC in a pregnant or lactating female. All these are important, my dear friends. Treatment of choice is ultrasound guided aspiration. If you fail 3 times in aspirating, 3 failed attempts of aspiration is the indication for incision and drainage. So, in breast abscess, you do not go for incision and drainage at a go. You need to first do aspiration and try to resolve the disease. Again, this was NEET 2019 question. What is the drug of choice for breast abscess? It is dicloxacillin. So, all these are important. The history, the first investigation, investigation of choice, and the first line treatment. Friends, you can make clinical snippets of many cases like this if you go and read about the case. For example, there was an AIMS question on thoracic outlet syndrome. We see this cervical rib or a case of thoracic outlet syndrome in our wards, and there can be questions about the tests being performed about the thoracic outlet syndrome. They are Roos test, Addison's test, Wright test. Mind you, my friends, cannot just know the name or the procedure of the test. You should be able to identify the test when a video is given. Video-based questions or GIF-based questions are very common these days. So you must be aware of the correct type of procedure being followed for these tests. For example, this is Roos test. Roos test is hand swinging by the side. This is Addison's test. Look, the neck is flexed to one side and then we look for the disappearance of the radial pulse. This is Wright's test. Hand is lifted above the head and then we look for the disappearance of the pulse. You should be sure about these tests, my dear friends, because in Addison's test the neck was flexed to one side, and again in Wright's test the hand was lifted and there is no neck flexion to one side. You must be aware of all these procedures, friends. Otherwise, you cannot identify the question or the test based on the answers. The answers will be very close to each other. So the options will be very close to each other, and you cannot identify the correct option unless you're 100% sure of the procedure. So you must be sure about the procedures you perform, the tests you do in the wards. Present, present cases regularly. Don't shy away from presenting the cases. Get rid of all your apprehensions. I am a second year student. I am a third year student. Why should I present? I'll present my cases in the final sim. This should not be our attitude, friends. You must try to present the cases right at the go you start attending your wards. Don't have fear. You'll all make mistakes, but the good thing is you learn from your mistakes. So don't shy away from presenting cases regularly in the wards. Aware of the procedures being performed in the ward. Again, my dear friends, we just present the case and we come to the diagnosis and we leave the investigation and the treatment part in the wards. We get to know about it in the internship, but as next one is set to be written and conducted before internship, you must be aware of the procedures being performed in your wards. For example, if you go to a medicine ward, you must be able to see the procedures being performed there. For example, taking an ABG sample, oil shoe insertion, blood sampling, types of injections. My dear friends, this is very important. The protocol and the type of injections, intramuscular, intradermal, subcutaneous, and IV injections. Which drugs are not to be given IV, which drugs are to be given subcutaneous. All these are very important. For example, we give insulin subcutaneous preparation, but in a case of diabetic ketoacidosis, we can give insulin IV, and the only insulin which can be given IV is regular insulin. So you should be aware of all these things you perform in the wards. All these are going down in your hospital. You just need to go there and observe. You just need to go to your wards and learn. Ascitic and pleural tap, the indications and the contraindications. Lumbar puncture. This is a very, very important question. You came across it in pathology and in medicine as well. So you must be aware of the procedures or the intervention parts being performed in the wards. You need to read them in the following subheadings. For example, indications, contraindications, the precautions you take, and the analysis of the report. For example, identify the procedure being performed. This is lumbar puncture. Lumbar puncture is usually performed in lateral decipitous position Again, my dear friends, some prefer sitting position because it is easier, but the lateral decubitus position is important and it is safer because the CSF opening pressures can be measured in lateral decubitus position, and in lateral decubitus position, the chance of brainstem herniation is also less. So, as per protocol, lateral decubitus position is preferred over sitting position in performing the lumbar puncture. The needle we use is 20 to 22 gauge needle. The location is at the level of L3 or L4 at the level of anterior superior iliac spine. Again, friends, if you don't come across this procedure in your wards, you cannot read about it and you cannot answer the question being asked about it. So you must be aware of the procedures being performed in your wards. Again, the absolute contraindication for lumbar puncture is raised ICT. How will you do how will you know that the patient is having raised ICT? You must rule out raised ICT by doing fundoscopy on the patient where you will find papilledema. So papilledema, raised ICT, absolute contraindication for lumbar puncture. Again, lumbar puncture is the investigation of choice to diagnose meningitis. This is also an important question. So, absolute indication, contraindications, the protocol being performed, the type of needle used, all are very, very important and can be future questions. Again, what is this? This is a Ryle's tube or the nasogastric tube. Again, you must be aware of the indications and the contraindications of nasogastric tube. In which poisoning nasogastric tube is contraindicated? In corrosive poisoning, corrosive acid poisoning. Again, a relative contraindication in kerosene poisoning. And it is safe to use a nasogastric tube in phenol poisoning. You must read about all this when you see an NG tube being performed. The ideal position to put an NG tube is sitting with neck flexed. This was also a previous AIMS question. So, practical based questions or procedure based questions are being asked in a huge way. So, you must be aware of the procedures being performed in your wards. ABG. Again, this is the procedure being performed is ABG or arterial blood gas analysis. Indications of ABG. How can you differentiate between a venous blood and arterial blood? This is very important because arterial blood is bright red and you can be able to identify it only when you do it once. And the arm should be held in complete extension. This was also a very important question. This was also a previous question. Allen's test is the test being performed before you do an ABG from the radial artery. Allen's test is used to check the patency of the superficial palmar arch. So, this is the Allen's test being performed, which you must perform before performing an ABG. It is used to check the patency of the superficial palmar arch. Again, similar looking test is Phalen's test. Phalen's test is done for carpal tunnel syndrome. It is used to rule out median nerve palsy. So, you should be able to integrate the subjects in such a way. Allen's test is performed before performing an ABG, is used to check the patency of the superficial palmar arch. Phalen's test is the test which you do for median nerve compression to check signs of median nerve compression in carpal tunnel syndrome. Again, my dear friends, integration is the key in learning in any exam, especially in competitive exams like Next or NEET. When you read about Allen's test, you are doing it to check the patency of the superficial palmar arch. Again, you should go back to anatomy and read about superficial palmar arch. Superficial palmar arch is formed by the superficial palmar branch of ulnar artery and it is completed by the superficial palmar branch of radial artery. This thing you must be aware before performing the test. Allen's test checks the integrity of the superficial palmar arch. Again, deep palmar arch is formed by the super deep palmar branch of the radial artery. Exactly the contrary to it. So, if you don't go back to anatomy and you applied basic sciences, you will never know it. So, you attend the wards and you read about the procedures, you read about the anatomy, applied anatomy part, then only you can integrate the subjects. Again, Fallon's test is used to assess the carpal tunnel syndrome, the nerve involved in carpal tunnel syndrome. This is also a previous MCQ, is median nerve. It gets compressed between the radial and ulnar fossa. This was also a previous year question. Again, if you go back to anatomy, and if you read about carpal tunnel syndrome, you'll find that median nerve runs below the flexor retinaculum. It runs deeper to the flexor retinaculum, and there it gets compressed between radial and ulnar bursa. Again, we should know that ulnar nerve is paired here because ulnar nerve is superficial to the flexor retinaculum and it gets paired. So you must read about the anatomy topics here. Structures passing deep to the flexor retinaculum, structures passing superficial to flexor retinaculum. This is how you integrate the subjects, my dear friends. So that's all about the procedures being performed in the wards. Let's see year-wise approach for next or NEET. Most probably next. Our year-wise approach should be like this. If you are a first year student, if you are reading anatomy, applied anatomy at the end of the lesson is very, very important, friend. Applied anatomy at the end of BD Chaurasia is going to make or break your rank. So read it carefully and read it mindfully. If you are in your dissection hall, special emphasis on the course of the arteries and the nerves, because, my dear friends, cadaveric images are being frequently asked these days. So, attend your dissection halls mindfully, and you should be able to trace the course of the arteries and nerves. Because only if you are aware of the relations of the arteries and nerves, you will be able to identify the nerve and artery, and then only you will be able to identify the nerve in the main exam. So, get your foundations right, get your basics right, then any kind of exam will be easier for you. Histology slide. My dear friends, histology slides are very, very important. You should be able to identify the different types of epithelia in the whole body in one go. You should be able to identify the transitional epithelium of the bladder, the pseudostratified columnar epithelium of the respiratory tract. Then only you will be able to identify the pathology in the lining or the respiratory tract. So your pathology depends on your histology, and your histology depends on your knowledge of application in the histology lab. Embryology is very, very important, friends, especially for exams like AIMS, especially thorax and abdomen development. Development of heart, tetralogy of Fallot is a very, very important and stressed upon question. Development of the diaphragm and the diaphragmatic openings, all these are very, very important. Development of the heart, diaphragm, testis, and scrotum, all these are very, very important. So, if you are an anatomy student, first year student, applied anatomy at the end of the lesson is very, very important. Dissection halls, you must attend them mindfully, with special emphasis on the course of the arteries and the nerves. Histology slides and embryology are going to be very, very important. For example, identify this. This is lateral epicondylitis or tennis elbow. Yes, you can answer it by seeing the image that it is tennis elbow or by it is lateral epicondylitis. But my dear friends, you must also know that the tendon which is involved here is extensor carpi radialis brevis more than extensor carpi radialis longus. This you can know only if you read your anatomy properly. You cannot answer this ortho question if your anatomy is poor. So you must know that there is a common extensor origin at the lateral condyle, common flexor origin at the medial condyle. So you should be able to identify them very easily if your anatomy is good. So anatomy and basic sciences are very, very important. Course of the nerves and arteries are also very important. For example, as I already said, the median nerve lies below the flexor retinaculum and lies below the flexor retinaculum and lies deep to the flexor retinaculum between the ulnar and the radial bursa. And the ulnar nerve lies superficial to the flexor retinaculum in the Guyon's canal. So you must be able to identify the course of the arteries and the nerves. You should be accustomed to think in such a way that if an image is asked for me, I will be able to identify the nerve and artery based on the relations. We should know that median nerve lies deep to the ulnar nerve. Then only we can differentiate between median nerve and ulnar nerve seeing the image. Again, my dear friends, Coming to physiology, general physiology is very, very important. The graphs and the topics are very important. The calculation of total body water, the calculation of the ECF volume, the calculation of the ICF volume, all these are very, very important. CNS, CVS, endocrine, and GIT, all these are very, very important. My dear friends, CNS, CVS, and endocrine, these are going to be the basics for your pharmacology, and your pharmacology knowledge is going to be the basic for your medicine. So read them thoroughly in your first prof so that you don't have to worry about them in your second and final year. And GIT physiology is also going to be very important. The graphs and the diagrams in CVS are going to be very, very important, my dear friends. And the cardiac cycle, you must be thorough with all the concepts of the cardiac cycle. It is the one which is tested in every point of medicine. Believe me, my dear friends, CVS in medicine solely depends on your physiology concepts of medicine. So you must be thorough about the pacemaker potential, the bundle of His, the synodal potential, and the types of automaticity, the effect of parasympathetic and the sympathetic nervous system on the slopes of these graphs. All these are potential MCQs, so you must be thorough of these right from your first year. For example, this is the graph that you must be aware in your first year. But believe me friends, this is the graph which travels with you all these 5 years. This is the diagram which you must be thorough with all these 5 years. For example, this is the curve of the ventricular pressure. This is the curve of the atrial pressure. This is the JVP. This is the curve for the ventricular volume. This is ECG and this is S1 and S2. So in the systole, in the ventricular systole, the events happening and the relations with the JVP, all these are going to be very, very important. And if you read them thoroughly in your first year, and if you have your concepts right, it will be very, very easy to apply them in your pathology and your medicine. So read thoroughly the CVS part from physiology in your first year itself. Practical physiology lab is going to be very, very important, my dear friends. Don't take this word lightly. The blood experiments you perform, the RBC count, WBC count, platelet count, the ESR estimation and the importance, the dilution factor you use, the multiplication factor you use, the dilution fluid you use, all were previous AIMS questions. So don't take these labs lightly. The normal count, the abnormalities, the pathologies related, all these are your Viva questions and your future MCQs. So be thorough and attend your boards mindfully. High altitude physiology and deep sea physiology are the ones which you'll come across all through your life. So all these 5 years, you'll listen about the high altitude physiology, the changes happening, the rise erythropoietin, the rise hematocrit, and polycythemia. How do you differentiate between high altitude acclimatization and polycythemia? All these are future MCQs. Deep sea physiology, the reflexes, and the barotrauma, Kaizen sickness, all these are going to be future MCQs. So high altitude physiology and deep sea physiology, don't take them light. You must be thorough with them right through a first year so that it becomes easier for you later on in the next years to come. Coming to biochemistry. In biochemistry, the metabolism of carbohydrates, proteins, and lipids are going to be very, very important. Metabolism component is going to be very important, my dear friends. Don't take this lightly. You should be able to draw the glycolysis and Krebs cycle in every MCQ exam. So you must be thorough with them right from your first year. The genetics part is the upcoming one, and genetics and the new types of gene therapies that is going to make or break your rank. Genetics is going to be very, very important in biochemistry, especially like with exams like next. Porphyrias, these are going to be very, very important. And the metabolism of heme and the types of jaundice, very, very important topic, especially for medicine. How will you differentiate obstructive jaundice from hemolytic jaundice? How will you differentiate hepatic jaundice from obstructive jaundice? The color of the urine, the type of the stones you get in hemolytic jaundice, all these are very, very important topics and potential MCQs. You cannot leave them. Porphyrias, these are the ones, the enzyme deficiencies in porphyrias are the ones that you have to read all these 5 years. So be thorough with them in your first year. The newer gene therapies, as I said, are going to make or break your rank, and these are the upcoming advances in biochemistry and they are going to be tested for sure in your next exam. Coming to practical biochemistry, the test for carbohydrates, amino acids, bile salts, and bile pigments. These are going to be very, very important. You must know the name of the test, the result of the test, and the inference you draw from the test. Clinical snippets of metabolic disorders, the ones you did in your biochemistry, these are going to be very important for your future exams as well. Tests for bile salts and bile pigments, and the urine tests are also very important. Friends, you must also observe the instruments being used in your biochemistry lab. They can be future MCQ questions. For example, this is a Benedict's test. We know that it is a semi-quantitative test, and we can know the amount of reducing sugar that is present in the urine by Benedict's test. Again, you should know what are reducing and non-reducing sugars. You should know that fructose is a non-reducing sugar and it is paired in Benedict's test. So you must be able to apply these concepts in medicine. If only if your biochem is good, you can apply it in your medicine. For example, identify the instrument used in your biochem lab. This is a spectrophotometer, my dear friends. So you must attend your labs and practicals mindfully, and you must able to identify the instruments, identify the procedures being performed in your first year. So first year labs, you cannot take them lightly, and you must attend them sincerely and mindfully. Coming to second year, patho, pharma, microbiology, pathology, pharmacology, microbiology. Believe me, friends, these are the three subjects that are going to make or break your rank in any competitive exam. Entire MBBS, entire MBBS rests on the shoulders of these second year subjects. Build your concepts slowly and thoroughly. Make your foundation rock solid, because these are the three subjects that are going to make or break your rank in any competitive exam. So, coming to pharmacology. General pharmacology is very, very important, my dear friends. The graphs and the diagrams in general pharmacology, the types of drug antagonisms in general pharmacology are going to be very, very important. Again, central nervous system pharmacology is very, very important. CVS pharmacology is also going to be very, very important, because these are the drugs that we use in your medicine. You can integrate pharmacology with medicine only if your pharmacology is good. As I said, physiology, pharmacology, and medicine, these are closely related to each other, and you can do better in medicine only if your pharmacology is strong. The antimicrobials and the drug of choice. These are a must question in any MCQ exam. So antimicrobials and the drug of choice are going to be very, very important. And again, coming to clinical pharmacology, though rabbit experiments are not being performed, you must be able to identify the interpretations based on the rabbit eye experiments and rabbit ileum experiments. When one drug is given, the motility increases. When another drug is given, the motility decreases. Like that, you must be able to identify. For example, rabbit eye experiments, atropine causes cyclopegia and mydriasis, whereas a drug like phenylephrine causes only mydriasis without cyclopegia. You must be able to know these interpretations. These were potential previous year questions and they can be asked again. Prescription writing, especially the dosing of the drugs, you must be aware of them. You cannot take them lightly because they can be used in your medicine. Integrate pharmacology with physiology and medicine. Coming to pathology, general pathology, believe me, my friend, everything in medicine starts from general pathology. That is cell injury, inflammation, and wound healing. Everything starts from these basic topics. So, general pathology must be at your fingertips. Coming to hematology, anemias, leukemias, and lymphomas, platelets and bleeding disorders. Leukemias and lymphomas, the N-Arbor staging of Hodgkin's lymphoma, the types of leukemias, the treatment of these leukemias. You can cover them in pathology rather than going for medicine. Platelets and bleeding disorders are also going to be very, very important. Coming to systemic pathology, you must integrate systemic pathology with medicine. The history and the histopath findings are to be correlated. Practical pathology. When you go to practical pathology lab, you must be able to identify the different types of slides and the epithelia and the pathology in them. These can be potential image-based questions in your next exam. Again, my dear friends, you can identify these slides only if you are good at histology. Again, the role of first year here, only if your first year is strong, your second year will be good. and your entire MBBS rests on the shoulders of second year subjects. So, pathology cannot be taken lightly, and these are the three subjects that are very, very important. Coming to microbiology, general and systemic bacteriology, everything in general and systemic bacteriology are very, very important, and virology and parasitology are also important. Integrate microbiology, infectious diseases part in general medicine. You can read microbiology from Harrison's as well, so you can cover a part of medicine in your microbiology, and then in this way you can reduce your load in your final year. For example, let's look at a question, my dear friends. This is a sample question to help you understand the concept of integration. For example, a 20-year-old male patient was admitted in view of severe diarrhea since 3 days. The diarrhea was associated with severe dehydration. He was hypotensive and the pulse rate was 140 per minute, and his pulse was thready and weak. On blood examination, his serum potassium and bicarbonate levels were low and he showed metabolic acidosis. He was started on IV fluids, ORS was given, antibiotics were given, and zinc supplementation was also given. On blood picture on TCBS agar, the organism showed the following type of colonies. We can see it is a bright yellow colonies on TCBS agar. Again, the question is not complete up to here. He was later put on an antibiotic dosing 100 milligrams twice a day. What is the mechanism of action of the drug? So, if you see, friends, it is a medicine question with a microbiology component and a pharmacology component, and you are expected to know the mechanism of action of the drug. So, in this way, this is the way integration works. As we know, any long question or any clinical scenario, you must be able to identify the keywords. You must be able to pick up the keywords. In this question, was admitted with diarrhea since 3 days, associated with severe dehydration, and he showed metabolic acidosis, hypokalemic metabolic acidosis. Again, only in diarrhea there is loss of bicarbonate, so there is metabolic acidosis in spite of hypokalemia. On blood culture on TCBS agar, the organism showed yellow-colored colonies. So TCBS agar, again, the first thing that should strike your mind is Vibrio cholera. The organism cultured on TCBS agar with bright yellow colonies is Vibrio cholera. With orange-colored colonies is Vibrio parahemolyticus. Again, this is your microbiology knowledge. This acidosis is your medicine knowledge. It was later put on an antibiotic dosing 100 milligrams twice a day. Drug of choice for cholera is doxycycline 100 milligrams BD. So, what is the mechanism of action of doxycycline? Let's have a look at the options. Inhibit translocation, inhibit the attachment of tRNA to A site, inhibit peptide bond formation, cause misreading of the RNA. So the correct answer is attachment of tRNA to the A site. So this is the way integration works, my dear friends. Here, doxycycline is the drug of choice for cholera, and it inhibits the attachment of tRNA to the A site of the 50S of the ribosome, and in this way it works. Let's look at the other options. The drug which inhibits translocation are macrolides and clindamycin. That drug which inhibits peptide bond formation is chloramphenicol. The drug which causes misreading of RNA are aminoglycosides. So you must be able to identify that there is a medicine component in this question, there's a microbiology component, and there's a pharmacology component. So you cannot answer the question just solely based on the knowledge of one subject. You must be able to integrate the different topics you read in your MBBS. Coming to forensic medicine. Forensic medicine is a subject you must be thorough and you must complete it in your second year itself. Legal procedure and important IPC sections. These are the must read in your topics. Toxicology. Types of incision in autopsy. The Y-shaped, modified Y-shaped incision. You must be thorough with them. Attend your dissection halls very sincerely. Your mortuary are the things where you can learn a lot. You must be able to identify the different types of specimens. For example, in recent times, the types of snakes were asked. These are all present in our forensic lab. So, you must attend your forensic labs and you must be able to identify different types of specimens, the different types of bullets, the different types of snakes. For example, snake bite and treatment is a very, very important question in your medicine as well. Don't read it from forensic medicine. You can read it from your medicine, and in that way, you can cover half of the portion of toxicology from medicine. For example, this was a recent AIMS question asking four different types of snakes and to match the following. This is king cobra, this is common krait, and this is Russell's viper. Friends, you cannot identify them unless and until you go to forensic labs and see the specimens out there. So you must go to a mortuary and you must be aware of the different types of autopsy incisions. You must see the procedure of autopsy. You must know the medical legal aspects of autopsy. You must know the indications and the contraindications. When do we do an autopsy? What is the medical legal significance of autopsy? And you must be thorough with the forensic labs and the specimens you see for your practical. All these are potential MCQs, so you cannot take them lightly. Coming to third year students, friends, this is your foundation year. Complete your notes and do all the groundwork needed. Prepare the notes of all the 19 subjects in your third year itself so that you can revise them and add the updates in your final year and you give your best shot in the next one exam. So third year is going to be very, very important, my dear friends. And it is your foundation year and complete all your notes and do all the groundwork needed in the third year itself. Complete notes of all the 7 short subjects like ENT, Opthal, Radiology, Psychiatry, Dermatology, Anesthesia, and Orthopedics, so that you'll be able to complete all the 7 short subjects along with PSM. So you'll be able to read only the final year 4 subjects in your final year, and there will be no extra burden to read the short subjects in your final year. Coming to very, very important subject, PSM. PSM is the subject that can make or break your rank, my dear friends. So read your park thoroughly. Every line in park is very, very important. For example, there was a recent MCQ. In park, there was a line. In typhoid fever, in typhoid, there is gastrointestinal disturbance. We all know that typhoid is a gastroenteritis, and in that, constipation is more common than diarrhea. This can be answered only if you have read Park. So read Park thoroughly. And reading Park as alone is not sufficient. You must practice MCQs. You must solve problems from biostatistics, friends. Biostatistics is very, very important, and you'll be given pen and paper in your exam. So you must be able to solve all kinds of problems in biostatistics. We BPC students are usually poor in maths, so you must be able to solve them in 30 to 40 seconds, the maths problems. So so start solving problems from biostatistics in your third year itself. Read epidemiology and antenatal care thoroughly. Epidemiology is the subject which is a foundation for any type of research in your future also. So read epidemiology thoroughly and read about antenatal and postnatal care, the universal immunization schedule, the number of antenatal visits, the number of postnatal visits. All these are future MCQs, my dear friend. So you must be thorough with all of them right from your third year itself. The instruments used in environmental medicine, the spotters which we see in our practical, these are going to be very, very important, my dear friends. You cannot take them lightly. You must be able to identify different types of spotters that we use in our MBBS. Friends, this is very, very important. Do not do infectious diseases part from SPM. You can do it from medicine and microbiology. In that way, you can integrate these two components and you can just see the epidemiology part from PSM. In that way, you can integrate infectious diseases from medicine, PSM, and microbiology. For example, my dear friends, this was a previous question. Why identify the apparatus being used? This is Horrocks apparatus. It is used to estimate the chlorine demand of the well. Again, there was one more question. How many glasses are being used in the Horrocks apparatus? It is 7. And how do you calculate the chlorine demand on the Horrocks apparatus? All these are future potential MCQs. Coming to ENT and Ophthal, attend the wards of ENT and Ophthal sincerely and mindfully. Don't just attend them for the sake of attendance. You must be able to identify, for example, if you go to ophthalmology ward, you must be able to identify the direct and indirect ophthalmoscope. How do you perform direct and indirect ophthalmoscope? In indirect ophthalmoscopy, there is real and inverted image. There is virtual and direct image indirect. The direct has more magnification. You should be able to perform the procedures, my dear friend. What is the distance if you use a direct ophthalmoscope from 25 centimeters? It is called distant direct ophthalmoscope. You should be aware of this. The OCT images, you should be able to perform how just see how the OCT is being performed. And different types of OCT images are all potential MCQs. So you must be able to identify different types of OCT images and darkroom procedures being performed in your hospital, the different types of lasers that you use clinically, slit lamp examination, and the lenses being used, different types of lenses, concave and convex lenses. What is the lens you use in slit lamp examination? What is the lens you use to correct myopia? What is the lens you use to correct hypermetropia? What is the lens used for astigmatism? What is the axis of the lens in cylindrical lens? All these you must be thorough while you attend your ophthal wards. Again, the procedure of fundus fluorescein angiography or FFA, this is also very important. And the different types of images in FFA is also going to be very, very important, my dear friends. If you go to ENT ward, watch for the procedures and the instruments being used in all the types of surgeries in the ENT OT. That in tonsillectomy surgery, mastectomy surgery, you must go to the tympanometry room. Talk to the technician who is performing the tympanometry. He knows a lot more than we do, my dear friends. The types of curves in tympanometry is going to be very, very important question. The types of instruments you use for septoplasty. What is the indication for septoplasty in DNS student? As we know, friends, deviated nasal septum is commonly seen in 40% of the normal population, but it is symptomatic in only 4% of the population, and septoplasty is only done in 2% of the population. For this, you should know what is Cotill's line, what are the indications of septoplasty and septorhinoplasty. You must be able to see the direct and indirect laryngoscope, and you must be able to identify the instruments on seeing them. You must also see a procedure of laryngeal papilloma excision or a laryngeal tumor excision or a biopsy of a laryngeal carcinoma. All these you can see only if you attend your wards regularly. For example, this is an OCT image where you see this is the retinal pigment epithelium showing detachment. So it is not retinal detachment, my dear friend. It is age-related macular degeneration. We say it is retinal detachment when the retinal pigment epithelium and the neuroretinal epithelium and there is space between them. So you must be able to identify seeing the OCT images. These are all potential future MCQs. For example, this is a tympanometry. If you go to tympanometry room, you see the types of curves in tympanometry. A type curve, AS type of curve seen in otosclerosis, AD type of curve seen in ocular discontinuity, type B curve seen in flat flat ear or in tympanic membrane perforation, type C curve seen in eustachian tube dysfunction without any effusion in the middle ear. You must be able to identify the different graphs. Coming to the final year. This year is going to be very, very important, my dear friends, because you are going to give your next right away after your final year. All your groundwork, all your updates, all your notes, you must be ready till your final year. In final year, focus on your core clinical subjects, that is medicine, surgery, obs-gynae, and pediatrics. These are the four subjects that are very, very important for your final year. Attend boards regularly, present cases, update your logbook regularly. Again, the logbook which you made in your second year and third year is going to come handy in your final year. Complete your preparation for theory exams and PG exams simultaneously. The more you read for your theory, it is going to be useful for your PG exams as well. For example, rheumatic heart disease, mitral stenosis, mitral regurgitation is an important university exam question, and it is important for your PG exams as well. So you can read them concurrently. Practical examinations and procedures are going to be very, very important, my dear friends, because you're not going to internship before you give your next one. So you must be aware of these procedures. As I already discussed the importance of these practical examinations and procedures. Coming to medicine, you can start with common cases first and topics first. Always, friends, it is important in medicine to keep reading the common things first. As they say, if you make a rare diagnosis, you'll be rarely correct. So start with common things first. For example, in CVS, rheumatic heart disease, mitral stenosis, mitral regurgitation, infective endocarditis, the pulse, the examination of the pulse, examination of JVP, all these are going to be very, very important. Coming to surgery, surgery start with long cases and theory first. For example, the varicose veins, peripheral arterial disease, the test being performed for the varicose veins, the test being performed for thoracic outlet syndrome, the test being performed for a thyroid case, the test being performed for the breast examination. All these are going to be your potential MCQs after that. Coming to obs-gynae, start with obstetrics first. The mechanism of labor is going to be very, very important. The dysfunctions of the labor, occipito-posterior presentation, the breech presentation, the malpositions, what are the indications and contraindications of cesarean section, all these are going to be very, very important. Again, friends, never let your standard textbooks down. You must read your standard textbooks one time or the other in your internship, in your UG days. You cannot just clear a competitive exam without reading the standard textbooks. It is very, very important for you to read the standard textbooks. For example, in pathology in second year, Robbins is the one which you must complete. My dear friends, Robbins is the wonder book in your MBBS and your UG life. You must be thorough with Robbins and you must read Robbins as many times as possible. The histopath images in Robbins are going to be your future aims questions and or next questions. So you must read Robbins as many times as possible. You should be able to integrate Robbins with other subjects. For example, if you read otosclerosis in ENT, take out the ear pathology part in Robbins and see about the histopath finding of otosclerosis. There you can see the blue whales in the sky appearance of in otosclerosis. In the same way, you should be able to integrate the different subjects, the medicine, ENT, ophthalm, anything you read in these subjects, you should come back to Robbins and read the pathology from Robbins. Robbins is one standard textbook which you must complete at least two times. Harrison. Harrison is a very huge book, my dear friends. So you cannot complete the huge Harrison in your first year or second in your second year or third year or final year. So you must start reading Harrison from your second year itself. Not everything is Harrison in Harrison is important. Only some topics in Harrison are worth reading. For example, in Harrison, in CNS, the parts of stroke and migraine are very important and very illustrating. In CVS, rheumatic heart disease and infected endocarditis are very important. In endocrine is especially important in Harrison, especially diabetes. Diabetes is very, very important. Not even a single exam has gone without asking question on diabetes. So diabetes is going to be very, very important. Coming to respiratory medicine, pneumonia and the protocols of pneumonia, the COPD management are going to be very important. And again, like we discussed, integrate infection diseases with microbiology in infection diseases in Harrison with microbiology in second year. That's going to be easy. So do not start reading Harrison in your internship or in your final year. Start reading Harrison from your third year, and in that way you can get used to reading these standard textbooks. Again, Bailey and Love. Bailey and Love is a very, very important and well illustrated surgery textbook. About 50 to 60 questions in recent exam were asked were direct lines, direct images from Bailey and Love. So you cannot just pass any competitive exam without reading Bailey and Love. So the important topics that you must go through in Bailey and Love are thyroid, breast, and GIT in Bailey and Love is also very important. Trauma and general surgery are also interesting. So the first thing you must read are thyroid and breast and the examination part of thyroid and breast from your clinical manual. In this way, you can integrate your practical and you can prepare for your practical and theory exams in one go. So, at the end of the day, my dear friends, it is the integration of different clinical subjects with your applied basic sciences. Integration is the key for any competitive exam. Understand how the disease correlates clinically, pathologically, and radiologically. See the radiological findings, pathological findings of the disease you come across in your ward. Read about it in your rounds. Read about the and update your logbook periodically. So at the end of the day, integration is the key. So whatever the exam may be, whatever the pattern of the exam may be, whatever the type of the question may be, we have come from OMR questions to the image-based questions, the clinical scenarios to video-based questions. So never let the pattern of the exam change your dream. Never let the pattern of the exam defer you from getting your dream branch of your choice in your dream college. So whatever may be the pattern, You must be thorough with your clinical concepts and your basics. And integration is the key to succeed in any competitive exam. And as they say, nothing worth having comes easy. So you got to work for it right from your first year itself. I would like to end this with the famous quote: "It's not the strongest of the species that survive, nor the most intelligent, but the ones that are the most responsive to change that survive." So you must be the one who are the most responsible to change. That's it, my dear friends. Thank you.